Rahim. Hello everyone, thank you so much for watching this presentation. My name is Tawalbeh. I'm a PhD candidate in the Fire and Emergency Management program at Oklahoma State University, and my advisor is Dr. Ray Chang, who contributed to this work too. So my research topic is role conflict among EMS providers and their willingness to report to duty during disasters with a focus on COVID-19. So these are the outlines for my presentation. Now, as we know, pandemics are considered among public health disasters that can cause a significant economic, social, and political disruption. So pandemic is defined as the occurrence of more cases of disease than expected in a given area or among a specific group of people over a particular period of time. So the severe acute respiratory syndrome of COVID-19 is considered as a pandemic as it started in Wuhan, China, and then widely spread to almost all world's countries. So this pandemic brought unprecedented strain on the healthcare system around the world and challenged it like never before in the recent history. Usually, when a disaster occurs, the public depends on the healthcare system to receive adequate medical care and support. As a result, the availability of healthcare workers is essential to accommodate the surge in demand for providing care. It has been found that the healthcare system generally works near its full capacity during even everyday conditions in the United States. As a result, pandemics can easily overwhelm the healthcare system, and as a consequence, it can cause a massive demand on the services provided by the system. All of this will affect the surge capacity and the ability of the healthcare system to treat the abnormally large influx of patients in response to this pandemic. Now, there are three important elements that can affect the surge capacity, which are personnel, equipment and supplies, and then structures. While all of these elements are important, but the availability of adequate personnel who are capable of providing care of victims is essential to achieve a successful response. But the problem here is that disasters such as pandemic can affect the willingness of healthcare providers to report to duty because of different reasons. As a result, it is essential to understand the conflict that might be caused by a pandemic and how it impacts the willingness of healthcare providers to report to duty during these situations. Several research studies examined role conflict phenomena among healthcare workers and how it affects their willingness to respond to duty. However, EMS is still considered as understudied in this area. So now EMS is being a unique system. Yes, it shares many similarities with the overall healthcare system, but it's considered as a distinct and unique system. This is because the primary rule is to provide emergency care outside of the hospital settings where it is demanding and unpredictable. So they are expected to devote themselves to the public good and to respond to disasters when they are called to. So they are unlike the other healthcare providers who work in a controlled in-hospital environment where it is stable, predictable, with the availability of most required equipment and resources. So as I mentioned earlier, the ability of healthcare system to respond effectively to disasters depend on the people who work within the system. So as a result, it is not realistic to expect that all healthcare workers will report to duty during any kind of disasters. So while several research found the healthcare worker feel obligated to respond, but most of them might be reluctant to report to work during pandemic for many reasons. Now, one of these reasons is the rule conflict. Even EMS providers are expected to lead the response action during disasters. Their duties and responsibilities as family members must be met first before responding. To the best of my knowledge, there is no qualitative study that addresses the impact of rule conflict on the willingness of EMS providers to report to duty during disasters. So this will be kind of the first for in the EMS area. Now, one form of rule conflict is work-family conflict, which is the focus of my study. Actually, my study will have important policy implications by assisting the policymakers better understand this complex phenomena. So the knowledge gained from this study will inform EMS education, research, and practices, as well as health policy related to the care of the responders and their loved ones. So it will suggest mechanisms to resolve this imbalance and rule conflict. Now, my study is guided by two research questions. The first one is, what are the sources of work-family conflict for EMS providers during COVID-19? And the second one, what is the impact of work-family conflict on EMS providers' willingness to report to duty during COVID-19? Now, despite all the extensive study regarding organizational behaviors, the relationship between work and family life is still not well understood, especially in the time of disasters. So the literature shows that work-family conflict can be intensified during disasters as EMS providers are faced with increased workload and overtime. As a result, they have to devote more time and energy to respond, and thus more work-family conflict will arise. Now, the theoretical framework that guides this study depends on the rule theory. The basic idea about rule theory is that individuals have different rules in life, and these rules guide how individuals should behave depending on their social identity and then the situation. When incompatibility occur between different rules, conflict will arise, where fulfilling one rule will be perceived as more difficult because of the pressure from participation in the other rule. So researchers indicated that most of the time, majority of people can manage to function effectively as members of different rules and different groups without any conflict. This is because people are unaware and do not recognize the cross pressure between multiple rules. On the other hand, during the time of disasters, people will be confronted with conflicting group loyalties and contradictory rules. So according to the work-family conflict pressure model that was developed by Greenhouse and Putel, there are three sources of work-family conflict. The first one is time-based conflict, such as time commitment at work. For example, how many hours worked by an individual on specific shift. The second one is a strain-based conflict, such as rule conflict and ambiguity that face individual within the work role and the level of support that they get in their working environment or setting. Now, the third one is behavior-based conflict, where individuals are expected to be self-reliant and to have emotional stability and objectivity at work. So all of these conflict sources can lead to an extreme and rare consequences of rule abandonment. This can occur when a person dismisses and abandons their responsibilities that associated with their expected rules. Now, since this study aims to gain a deep understanding of the work-family conflict phenomena, I choose to use qualitative design with semi-structured interviews with purposive sampling in order to recruit 30 participants from different US states. Now I'm gonna talk about my preliminary results for this study, and the results were according to the following. For research question number 1, which is the sources of the sources of conflict, work-family conflict. The first theme is personal and family concern, as you can see in here. So most of the participants expressed fear and anxiety related how responding to this pandemic can affect the well-being of themselves and then the well-being of their families and loved ones. So most of them are concerned on how they can take precautions in order to protect themselves and their loved ones. Another theme is the dealing with constantly changing information. Most of the participants described how frustrated they were because of the huge influx of information they received about the virus, and then the different guidelines, the changing protocols that will change every day regarding how to respond to this pandemic, and even what PPEs to use. So there was a clear sense between the participants that the volume of information was overwhelming for them. Now, leadership mistrust with employer transparency was another emergent theme. The issue of employer trust emerged during the interviews. So some of the participants reported that their leaders were not great in keeping them informed, and they did not believe that their leaders will share information promptly when they received it. So other participants expressed their fears that their leaders do not have a clear plan of how to respond and how to take care of them, or even how to support them in the case they got sick. Now, the third theme that is related to strain-based conflict is lack of preparedness, which include first lack of resources such as PPEs. So most of the participants reported that they faced shortage in protective gear at some point, especially during the beginning of this pandemic. They expressed a significant concern regarding the PPEs, not only its availability, but also its age. As one of the participants expressed how their previous stockpile of the Ebola 5 years ago found to be expired. Moreover, most of the participants expressed the lack of training and education regarding how to respond to such pandemic. So some of them described their previous training about infectious disease as limited, insufficient, and causes them to be uncomfortable and more fearful to respond to this pandemic. So other participants also expressed that their Ebola training in the previous years included how they should respond to pandemics, but because they never used it before, one of them expressed that if you don't use it, you kind of lose it. Now, the last theme that emerged from the strain-based conflict is the adaptation with the new reality, with the added new life practices. So some of the participants described how EMS has an inherent safety minded and how EMS providers are protective in nature. So all of the participants reported that they have new life practices to ensure their safety and their loved ones' safety. Some of these practices include disinfecting their gears, washing uniforms, some of these also taking shower before interacting with family members and being more aggressive even with these practices, as they don't know what climbed into them on the way home. All of these practices were described to be overwhelming and consume a lot of energy. Now, the second source of work-family conflict is behavior-based conflict. Now, the dominant theme in this conflict um, is the negative emotions for participants and the stressful relationship with their family members. So some of the participants expressed negative emotions, and some of these negative emotions were frustration, overwhelming, stress, fear, anxiety, discomfort, and upset. So participants expressed how the pressure of responding to this pandemic caused them to have negative emotions that were expressed in multiple um, fights with their family members, especially at the beginning of this pandemic, because there was a high level of uncertainty and unknowing that dominates this situation. Other participants described how they were anxious to get this virus and how the idea that they will get it continuously sit in the back of their head. So, one participant expressed how responding to this pandemic caused him to have some PTSD symptoms, post traumatic stress disease symptoms, such as a lack of sleeping and having repeated dreams about getting this infection and about the patients that he dealt with during this pandemic. Now, I'm going to talk about the last source for this conflict, which is the time-based, with a dominant theme here of adapting a new working environment with the added workload. So most of the participants reported how the new tasks of aggressively disinfecting the back of the ambulance, the station, and their protective gears were overwhelming and time consuming. Other participants also reported more administrative work, especially when they have to deal with a positive COVID patient. So another issue was the added shifts for some EMS providers, as they have to cover for their co-workers who are in quarantine, who get sick by themselves, or another co-workers who were not able to go to work because they don't have anyone to take care of their children, as the child care and schools are no more open. Now, for the second research question, which is the willingness to respond to this pandemic, um, there are three dominant themes for this question, and nearly all of the participants reported that they will remain willing to report, but with different views and commitments. So some of the participants expressed a high level of ethical obligations to work, in their views, whatever happens, whatever the risk is, they are still coming to work. They believe that this is their job and they will keep reporting to duty unless they are sick themselves. Other participants reported that they are responsible to report to duty and that this is a part of their inherent work culture, as they are used to respond even during the worst condition, and they also reported that this is what they signed up for. A few participants expressed that they are obligated to show up to work because it is their only source of income. But in general, all of the participants reported some concerns that might affect their willingness to respond, but none of them reported that they will not show up and respond to duty. Thank you everyone for listening to this presentation, and now you are welcome to ask any questions you want. Thank you so much.